Hello, I'm Lisa Gray, Executive Director with the Simsbury Chamber of Commerce, and I'm here today with Karleigh Feda, who is the manager of the Simsbury Office of Select Physical Therapy. Select Physical Therapy is our featured member for the month of November. Welcome, Karleigh.
Thank you.
Nice to see you today. Thank you for
too.
joining us.
Thank you.
So, Karleigh, how long have you practiced physical therapy?
I've been a licensed therapist for just over 4 years now. I earned my doctorate degree from the University of Hartford in 2011, and I started my career with Select Physical Therapy in our West Hartford location. That was actually one of the places where I had done one of my internships. And then I moved to Simsbury this past July to manage that clinic.
Okay. So beyond your degree, what other training do you have?
I have training in advanced sports care, so treating people on the field and in the clinic, concussion and vestibular treatment, and just a variety of techniques to use in the clinic.
And how many offices of Select Physical Therapy are there now?
We're a large corporation and we're nationwide. We offer rehab hospitals, skilled nursing facilities, and outpatient clinics. In Connecticut, we have about 45 outpatient clinics. Even though we're large, each clinic has its own personality and kind of a homebody feel.
So what exactly is outpatient physical therapy?
Well, to start, physical therapy is the treatment of musculoskeletal conditions, so meaning injuries to your muscles and to your bones. These are primarily from activities of daily living and from recreational activities. Outpatient physical therapy are when patients are able to come to see us in our clinic versus someone who's considered homebound, where they'll receive home care, or hospital bound, where they'll receive care there.
And do you have other therapists in your practice besides you?
We do. We have another licensed physical therapist and 2 certified athletic trainers.
What do the athletic trainers do?
The athletic trainers are based out of Simsbury High School. They do most of their work there, working with the athletes during their practices and their games. And whenever one of them is injured, if they can't treat it themselves, they refer them to our clinic.
So what are some of the injuries that you treat? What are your most common things that you see?
We treat a wide variety of injuries from head to toe. We work to improve function, restore range of motion and strength. We work to improve mobility in those who have had fractures in your upper extremity, your lower extremity, and even your spine. We work with muscular issues such as tears or strains or even bruises. We will work on people who've had surgeries to repair tendons and ligaments. And we also work in improving the symptoms of people who are suffering from concussions or vestibular issues or even just osteoarthritis. I would say our most common injuries that we treat are probably neck pain and low back pain, shoulder issues such as rotator cuff tears, knee issues such as patellofemoral pain or ACL repairs, and then most commonly probably foot pain, Achilles tendonitis, plantar fasciitis.
Okay.
Yeah.
So are there any injuries that you won't treat or can't treat?
If it's highly specialized, we may refer them out. For example, if we are treating hands, we can treat hands, but sometimes they're very specific and require the use of a specialized hand therapist.
Okay. Are there any special services that the clinic offers?
We do. The PTs and the athletic trainers have advanced training in sports therapy, so in the clinic and on the field emergency situations. We also have training in concussion and vestibular treatment, and recently have taken on a new technique called dry needling, which is a Western technique using acupuncture needles to go into muscles, into the trigger points specifically, to help get them to release. And then we also do instrument-assisted soft tissue mobilization, which is using metal tools to help break up scar tissue in the muscles.
Is that painful?
It can be, but you know the saying, no pain, no gain.
Oh boy.
Sometimes you have to cause a little discomfort to get the results that you want.
So how do you typically acquire your patients?
Well,
They come to you directly or referred by their
they
doctor?
can. Most of our patients come from a direct referral, so patients will see their primary care physician or a specialist first, who then refers to us. We do see some patients directly. There are new laws in Connecticut that allow direct access, so patients can bypass their doctor and see us. Not all insurances require that or allow that, so we will have to double check and verify that for you.
Now, what can a patient typically expect from a therapy session? What are they in for?
Usually the sessions are an hour to an hour and a half long. When they come in, they'll get started with a modality such as heat or electric stimulation, or we may even put them on a bike just to get things moving and loose. After that, the therapist will assess the patient and determine what needs to be worked on. And what I mean by that is the therapist will perform some sort of technique, whether it's stretching, a soft tissue massage, traction, range of motion. And then following that, the therapist will guide the patient through a series of exercises specifically designed for that patient and their needs. And following the session, the patient can get ice if they're sore, and the therapist will provide the patient with a written home exercise program.
And how often do patients go to therapy then?
Usually it's 2 to 3 times a week. That's determined by what the physician orders and what the therapist sees is needed in the patient. And then we base it off of, what the patient's goals are too. If they're trying to get back to a sporting event, we might get them in more often than someone who just has more of a chronic injury.
So how would a patient know if they need to seek physical therapy as opposed to just taking an ibuprofen or a Tylenol or just seeing their regular doctor or another practitioner?
Well, generally people have a pretty good understanding of their body and what hurts, especially if they've had physical therapy in the past. A lot of people will start with over-the-counter medicines, and if that's not improving their pain, then they need to seek some sort of medical attention. We offer complimentary assessments at our facility, so patients can come set up an appointment with a physical therapist for free. He will assess the patient and determine what's the next course of action, whether it's physical therapy or if something's really wrong, send them to urgent care or back to their physician.
Okay. And is there a typical length of time that a patient is in therapy?
There's not. It's really dependent on the severity of the injury, the age of the patient, what the patient's goals are, if there's any comorbidities like cancer or if they're a smoker, and if the patient's willing to get better too.
Yeah, and I would imagine that their participation in the activities you're giving them to do at home probably has a lot of bearing on how quickly they're going to heal too.
You can't get better or expect to get better with just 1 to 2 visits a week.
Right,
you have to do something on your own.
Yeah. So tell us about one of your success stories. Is there a patient that particularly sticks out in your mind that had a very interesting or difficult, challenging issue that you had to deal with and you were able to solve it for them?
There is. I recently had a phone call from a local physician who sent over, or who told me that he had an athlete in his office with a severe ankle sprain, and she had an upcoming tournament that she needed to be in. I was able to get her in that day. She was swollen and bruised. She had minimal weight bearing, and I treated her every day that week. By the next day, I was able to get her fully weight bearing. Soon after that, we were practicing sport-specific activities.
Wow.
By the end of the week, she was ready to play, and she went on to her tournament, and it was great. What was challenging about that case was that we really had a short amount of time to get our get to our desired goal.
Oh, that's fantastic. I'm
Yeah.
sure she was very happy with
She
that.
was.
Yeah, good. Okay, great. Is there anything else you'd like us to know?
Just that, like I've said before, Select Physical Therapy, we're a large company, but each individual office is very in tune with the town that they're in. Simsbury office has been in town for many years now. We are involved at the high school. You can see us at the high school games. We do a lot of town events such as the Iron Horse Marathon and the Chili Cook-Off. And you can even see us at local health fairs as well.
Great. So you're definitely visible out there in the
We are.
community involving yourselves.
Yeah.
That's great. Good to know. Well, thank you so much for joining us today.
Thank
It was
you.
nice talking with you.
You too.
I'm Lisa Gray, Executive Director with the Simsbury Chamber of Commerce, and I've been here today with Karleigh Feda, Manager of the Simsbury Office of Select Physical Therapy. Thank you for joining us.
Funding for Simsbury Community Television is provided in part by contributions from viewers like you. Thank you.